A midline is an intravenous catheter inserted into the upper arm with the tip located just below the axilla. These devices are placed using an aseptic technique in the upper arm. The tip of the device does not reach the central venous vasculature. Externally, midlines and PICC lines look very similar. However, midlines do not reach the central venous vasculature. This means they are not suitable to administer drugs which require central venous access. Midlines are indicated for difficult IV access or prolonged IV access up to 29 days when central venous access is not required. To access the device, firstly, confirm patency of midline with flashback of blood by easily flushing. Using ANTT, the port should be cleaned with chlorhexidine for 30 seconds. Flush each lumen using the push-pause technique with 10 ml of saline every 12 hours or after use and between drugs. Clamp each lumen under pressure. If blood products have been administered, a 20 ml flush is required. Once patency and flushing confirmed, administration of medicine should be in a syringe appropriate for the size and dose. Do not infuse against resistance and seek help if this occurs. As this is a peripheral device, drug selection is similar to that with a PVC. Assess the external length of the midline before use to avoid displacement. These lines are not sutured in and the midline is held in place by the dressing. Clean the exit site with ChloroPrep for 30 seconds using a back and forth friction rub and allow to dry. Dressing should not get wet during bathing or showering, and a waterproof covering should be used. The device is secured with steri-strips and a Securicath under a transparent dressing. Change the dressing every 7 days or sooner if wet, detached or soiled. If the patient has an intolerance to the transparent dressings, use Duoderm. The Cardiff and Vale midline care plan will be available for each patient in the bed space. This will provide further guidance and information for care and management of midline. The care plan includes VIP scoring, flushing record, dressing change and measurement at exit site documentation, and should be recorded each shift. Midlines should be removed when they are no longer required or if they have been in for 29 days. They can be removed by any qualified nurse following these guidelines. The patient should be in a sitting position or on a bed with the midline exit site below the level of the heart. Using an ANTT, remove the dressing, steri-strips and stat lock. Pull out 2 inches at a time, moving your fingers as close to the exit site as possible. If resistance is met, stop, as this may be due to vasospasm. A heat pack can be applied for 5 minutes prior to resuming. If resistance still occurs, seek help. Remember, the midline is a peripheral line and not for use with centrally acting drugs. Do not use the BP cuff on the arm that the midline is placed. Any dressings near to the midline need to be loose. Do not administer chemotherapy via a midline. Always use ANTT when touching the midline and ensure documentation is complete in the care plan.